Given how far the world has come with medical research and advancements in medications, we are not as effective in preventing and eradicating HIV as we could be. This is not because we lack the tools or the ability. It is because of the stigma associated with sexual health and HIV. With decades of experience in direct medical care and clinical research, Dr. Ortiz shares his knowledge and expertise regarding the most effective approach to reducing and eliminating new HIV infections. To end HIV today, we must focus on stopping the spread. The great news? We have everything we need to accomplish this. The bad news? Infections continue to rise. Every HIV-positive patient that goes untreated will continue spreading the virus exponentially, like a domino effect. And while HIV is no longer a death sentence, due to the highly effective medications available today, we are better off avoiding HIV altogether. Preventing new infections will eliminate the stressful psychological toll of diagnosis, the financial burdens, and the lifelong dependency on medications. It is also important to note that HIV without treatment is still a lethal virus. The solution to prevent new infections. Every sexually active person living with or at risk of HIV will take one pill daily until the virus is completely phased out. This practice will not only stop the spread of the infection, it will also be the great equalizer. Regardless of HIV status, every person will have the same protocol. Take one pill a day and enjoy the same health benefits. No HIV transmissions. Normalizing the taking of medication will eliminate the stigma currently attached to being positive or on treatment. This stigmatization has prevented people from caring for their sexual health. If everyone is doing it, we take the fear out of sex, and instead of evaluating a person for their HIV status, everyone can either be a part of the solution, taking one pill a day, or a part of the problem that continues the proliferation of HIV. The focus should be put on the incredible technological advancements we have available. First, we have treatments that repress the virus to 0% chance of spreading the infection. This means HIV-positive people taking these medications are physically unable to transmit the virus to somebody else and are protected from reinfection. Second, PEP is a medication for HIV-negative people that blocks the virus from entering a person's system after exposure. Anyone who is exposed to HIV through a needle, sexual encounter, or other has 72 hours to start PEP. They take it for 28 days and remain HIV negative. And third, there is PrEP, a preventative medication for HIV-negative people. PrEP blocks the virus from entering a person's system. Anyone taking this medication regularly will not contract the virus. It is revolutionary, and every sexually active person needs to be aware of it. PrEP eliminates the risk of contracting HIV when taken daily. Period. Research has proven these medications are some of the safest in the market for people of all ages. With little to no side effects, these meds are safer than most over-the-counter medications. Although expensive, these medications are available free of charge to anyone who wants them. Free. In addition to focusing on educating about these incredible medications, we must also revise a few existing concepts in terms of HIV prevention. We need to reevaluate the Know Your HIV Status campaign, ideas about routine HIV testing, perceptions of who is at risk and what is taboo versus safe practice. The Know Your HIV Status campaign needs to be revised. The problem with this message is that it forces people to unknowingly lie and leads to new infections. To understand this, we need to take a look into the anatomy of an HIV test. To get an accurate test result for a rapid saliva test, the person must wait 6 weeks without sex, an unrealistic expectation, to check for one particular sexual encounter due to the window period or incubation period it takes the virus to be detected. Other HIV tests require different window periods. However, a test result becomes obsolete after the next sexual encounter. What we need to clarify is that there are only two ways to know your daily and accurate HIV status. 1. To be HIV positive, because once a person is diagnosed, the person will remain HIV positive. And 2. To be compliant with PrEP, since PrEP eliminates the risk of contracting the virus. Routine HIV testing as a preventative method does not work. Due to the complexity of the testing timeline previously mentioned, it creates a dangerous and fictitious grace period between tests that leads to new infections. People are misinformed in thinking that getting tested every so often keeps them safe from contracting the virus. This is not true. The reality is that most new HIV infections come from people who thought they were negative, but were in fact positive. We must redefine who is at risk of HIV. There are major misconceptions. Every sexually active person is at risk of contracting HIV, some more than others, depending on their circumstances. HIV attacks everyone, regardless of race, sexual orientation, social status, relationship status, or age. Thinking the virus will not affect your demographic puts you at risk and leads to new infections. The message must be altered from reduce the risk to eliminate the risk and the fear with PrEP. Lastly, we need to clarify what is taboo versus what is considered safe practice. Research shows that abstinence, monogamy, and condom use are unrealistic expectations that lead to new infections. The only way to eliminate the risk of an HIV infection is to be compliant with PrEP. In summary, for HIV-negative people, there is a medication that will prevent HIV infections and keep them negative. For HIV-negative people who are exposed to the virus, there is a 28-day medication regimen that also prevents them from contracting the infection. For HIV-positive people, there is a medication that virtually eliminates the virus and makes it impossible to transmit the virus to someone else and be reinfected.
These medications are now available in injectable form. This greatly improves adherence to safety protocols.
Lastly, routine HIV testing as a preventative method does not work. It creates a false sense of security and safety and is likely to condone risky behavior.